Hi, everyone. Thank you so much for joining us. This is going to be a really interesting conversation and probably very relevant for everyone's day-to-day lives. I think we all share something together, living through a pandemic. So we're going to be talking about that and where all of the work you do fits into that. So Dr. Kamran Khan, CEO and founder of BlueDot, an infectious disease intelligence company, as you just heard. He also worked on the front lines during the SARS crisis in Toronto back in 2003, still a practicing physician and a professor of medicine and public health at the University of Toronto. So welcome today.
Thanks for having me, and just call me Cam.
Call you Cam. Okay,
yeah.
Perfect. Yeah, you wear a couple hats, so we'll call you Cam. Walk us through BlueDot. As we heard a moment ago, you were working on COVID before it was called COVID, and trying to figure out what this virus was about. So walk me through what that was like.
Yeah, so, as you were mentioning, I was a practicing physician, actually just the beginning of my career during SARS-CoV-1, which was actually right now, 20 years ago at this time. We were just coming out of SARS-CoV-1. And, at that point in time, what I saw was kind of incredible to see this virus kind of paralyze a city. And it wasn't just Toronto. There were dozens of other cities around the world. So that was, for me, kind of that aha moment that I have a feeling there are going to be more of these. This isn't going to be a one-time event. So that was the inspiration behind BlueDot. And BlueDot didn't actually materialize until, more than 10 years later. As you mentioned, I'm an academic and a professor. I've been studying outbreaks for pretty much the last 20 years. But one of the things that became very clear as we went through the flu pandemic in 2009, H1N1, Ebola, and others, was that we have to move faster. These outbreaks appear without notice, and they move really quickly. And so BlueDot was ultimately founded really to leverage global data and advanced analytics and things like machine learning to help us detect outbreaks earlier without having to rely on official sources, because we know we aren't always going to get information in the most timely manner, to understand threats really quickly, anticipate where they may be going to next, and then ultimately empower different organizations like governments and including the private sector to be able to mobilize timely responses so we can at least mitigate some of the health and the economic and social consequences of these types of outbreaks.
So how did that work in 2020 when we were getting those early warnings that some kind of virus was spreading in China?
Yeah.
What work did you do to figure out what was going on?
So we had built an engine actually long before COVID, which was using language models and machine learning to scour the web and look for early signals of outbreaks that weren't necessarily being officially reported. We're doing this in 130 plus languages. It's every 15 minutes around the clock. And what we wanted to do was to gather intelligence that was free from political influence or any potential bias. We wanted to look around corners and kind of see what was happening. What we picked up was that there was an unusual respiratory syndrome circulating in Hubei province, and it wasn't the kind of usual suspects like influenza. Again, keeping in mind December is flu season. It wasn't any of those things.
Right.
And so, our platform picked that up, but it was, part of our experience and my own personal experience during SARS-CoV-1 that really sounded the alarm for me, which was, I think this could be another outbreak that has pandemic potential. And so that was kind of where everything started. We immediately notified all of our clients and partners, and then we went on to actually publish what was the world's first peer-reviewed study on COVID. It's actually so early, it's called Pneumonia of Unknown Etiology in Wuhan, because it hadn't even been confirmed to be from a coronavirus at that point. And then, there's a long 3+ year story that follows from there. But that's how things got started.
Okay. What's so fascinating to me about that is that balance between looking at all this data and the machine learning side, but also human expertise. You're not replacing people with this work. You're still bringing the expertise of physicians and experts like yourself, essentially.
Yeah, I don't think this is a machine versus human question. I think this is a machine and human problem that we ultimately need machines to play to their strengths humans don't read text in 100 languages, and we have to sleep and so forth, and we get machines to do that. But we also have to remember that machine learning is really based on historical data. So how many historical data points do we have on novel coronaviruses? So this is where, again, human intuition, insight, understanding of context becomes really important in a way that a machine can't, especially when you're dealing with something that has never happened before.
And that was so surprising about this pandemic, was we had not had a coronavirus global pandemic before. Right? There would be no data to look at for that, essentially.
I mean, the closest thing was SARS-CoV-1, which wasn't necessarily a pandemic, but pretty close to one. It was a, international outbreak.
So let's talk about where we go from here, because we know living through one pandemic now in our lifetime, this probably won't be the last. We hear from medical experts all the time that they're predicting, a lot of these viruses will spill over from animals to humans. There's a lot of factors at play in that. How do you figure out and track the next potential threat?
Well, there's a lot of science that's also happening around, folks that are in caves and remote jungles and so forth and trying to capture viruses that might possibly someday spill over into humans. What we're doing at Blue Dot is really providing that early warning. So what we're doing is looking for those early clues and signals that something new is arising. Now, as you talked about, there will be more pandemics as we go forward. I don't want to be an alarmist. I realize that we're all pretty exhausted from the last several years. And as someone who was treating COVID patients in the ICUs before we had vaccines, I'm as happy as anyone that the worst of this pandemic is behind us. But the reality is there are kind of a confluence of global forces that are driving the emergence and spread of these diseases.
What are the big ones to you, the biggest factors for why we might see more of this now?
Biggest one, I would say, is human interactions with wild animals. If we look at everything from HIV to SARS to H1N1, the so-called swine flu pandemic, Ebola, Zika, these all originate from animals. And so what's happening is humans are increasingly encroaching upon viruses that we've never encountered before, like SARS-CoV-2.
Because of migration, population growth, all of the above?
A lot of it has to do with things like urbanization, deforestation, the industrialization of agriculture. So as we, cut down forests, we are disrupting those wildlife ecosystems. Those viruses, there are more chances for them to expose a human, or if we set up livestock and start doing industrial farming, those viruses may go into swine or into poultry, and then we end up consuming them. And those are the sparks now that are happening with much greater frequency. And, and unfortunately, that's kind of the catalyst. But if we even go beyond that, urbanization, more than half of the world's population now lives in densely populated cities. So there's lots of benefits to being in a city, but as you can imagine, there's a lot of contact between people, as we see here. And that trend is, we're expecting that by 2050, about 70% of the world will be highly urbanized.
Right.
And we have, of course, all those cities are connected through travel. And then the world is also becoming more fragile as we think about inequality, the impacts of climate change. The world is a little more susceptible and have those conditions that lead to outbreaks.
So when you have all those conditions, and we have everyone saying we'll probably see more of this, how do you figure out which of those little sparks, that moment of a few people getting infected in one city, how does your company and the sort of technology you use determine which of those will be a forest fire or a global inferno, a pandemic of sorts?
I'm glad you asked that, because it's a really important question. And for most in the audience, you probably don't want to know what we are tracking on a day-to-day basis, because there are things happening across the planet every single day. But you're right. We've got to be able to quickly understand, which ones demand our attention, which ones have the potential for disruption. And I would say this is a perfect example of how machine intelligence is complementing human intelligence. We always look for things that are anomalous. And the way that we can identify if something is anomalous is we have to have historic data to say, well, what normally is, like if this is a known microbe like Ebola, well, where is it normally found? Is it in an unusual location? Or if it's influenza-like illnesses, are we seeing a surge at an unusual time of year? So these would be the kinds of things, or even are the clinical manifestations of like how somebody gets sick, is that different from what we are expecting to see? As we see those kind of unusual anomalous events, and we can have a machine do some of those analytics, we then complement it with human intuition and perspective on what do we understand about this microbe, its biology, its ecology, virology, and so forth. And those are factors that when we put them together, I think we have a much better context of is this something that has the potential to go all the way.
I mean, the amount of data that you must have to go through is sort of overwhelming. And we've even seen in the last few years, going through COVID and then something like Mpox emerging last summer. Something that's endemic in Africa, that had generally stayed in that area, all of a sudden appearing in communities all around the world, including here in Toronto.
Yeah.
How do you handle that amount of data when you're using your technology to parse through that?
Yeah.
What is the process for that? I mean, how do you pick out something like Mpox that essentially surprised the global community?
Yeah. Well, no doubt that there will be surprises. I mean, I think one of the things I've learned, having worked through now quite a few international outbreaks, is that there's always a curveball or two. There's always a surprise that is just completely out of left field, and you wouldn't even. Just think about Zika virus. We'd never imagine that a mosquito could transmit a virus that causes birth defects in the womb. I mean, there's no parallel to that. So there's always a bit of a surprise. But going back to how we manage data, I don't think the problem so much is, I think of the V's of data and the volume and the velocity, I don't think the volume is so much the issue, it's the variety. So we're having to look at data that's unstructured text in all these languages.
Right.
We are pulling in data on almost every ticket that is purchased on a commercial flight worldwide. We are pulling in meteorological and climatic data, data on the observations of mosquitoes across the planet. So there's a diverse mix of data, and they are not all if you just imagine Legos, they're not all developed to actually snap together. So there's a ton of engineering that has to happen. And then there's a lot of subject matter expertise that needs to be integrated to say, this climatic condition influences the biology of this mosquito in this way, which leads to transmission of a disease in the following way. So there's a lot of that engineering and then the subject matter expertise. And that's really how we built the organization at Blue Dot. It's purpose-built from the ground up, eclectic mix of veterinarians, infectious disease physicians, epidemiologists, experts in ML, and it's that diversity of skill and expertise that really helps us make sense of all of this, not just large volumes of data, but the variety of the data.
And how do you even get that amount of information in? Because when it comes to people's health, there's a lot of regulatory hurdles with some of that data. I mean, there's patient privacy legislation, hospitals have privacy legislation, but a lot of what you're talking about is sort of circumventing that in a way, potentially. So how do you actually get the information that you're using?
Well, I could probably talk for about an hour on how we approach all of that, but what I'll say is the overarching principle is we are centralizing and bringing together the highest quality data that we can possibly get. So in some cases, it's actually distilling information. Just imagine of course, the internet is this vast medium. We're distilling and finding the needles in the haystack and presenting those. We are going to industry, into the private sector, and pulling data together that we essentially need to understand how people move across the planet. We're bringing data from satellites together and bringing those in. When it comes to health information, currently we're not actually going directly into individual patient level data, but we are looking for those population level indicators that something is occurring in the population. But this is, an area that, as we're thinking about our future and our trajectory, we ultimately want to be. Today we're empowering governments and private businesses, but we also know that citizens want to protect themselves wherever they're going in the world. Healthcare providers like myself, we encounter patients who've just come back from, a remote jungle somewhere with a mysterious illness. We've got to be able to actually figure out what they've got and manage them and execute on that perfectly. So there's a lot of intelligence that needs to be disseminated to different audiences. This is not a government alone problem, nor is it an industry alone problem.
Let's talk about what happens when you don't catch these things in time. Because again, you know, we lived through COVID. That was obviously a ton of pressure on the healthcare system, millions of lives lost around the world. You know, is there something worse out there? What happens if we don't prepare and if we're not tracking things in these sorts of ways on a global level?
You know, I'm going to answer that question by thinking a little bit about, you know, human psychology for a moment. And, you know, I've been, again, through enough of these outbreaks to see this panic neglect cycle happen over and over again, where you're in the midst of an emergency, there's a very vigorous response, and then as soon as it's over, it's, you know, I think this is just the way the human brain is wired, right? We deal with kind of fast-moving threats better than we do perhaps with ones that are slow-moving, or even if we know that something is inevitable. You know, there's a famous aphorism, I think it's Santayana, those who cannot remember the past are condemned to repeat it. And I think we're actually at that moment right now, which is we all want to just forget about what happened, and I totally get that. But as we discussed earlier, like this problem and the factors that got us here haven't gone away. But I think the key point that you've highlighted, which is really was the inspiration for founding Blue Dot, is this is one of those profound things that can disrupt all of humanity, and that's not hyperbole. We just lived through it. And you know, when we think about the severity of COVID, I'm not sure that I would call that a severe pandemic. I would say that was probably a moderate severity pandemic. H1N1 was kind of more of a milder pandemic.
It could have been worse, basically.
It could have been worse. Again, I'm not here to be an alarmist, but I would say it absolutely could have been worse. I mean, we know of other pathogens and diseases, you know, I've been doing this in practice for 20 years now, that are far more virulent than COVID-19. So a combination of something that is more deadly and more transmissible, that's not out of the realm of possibility.
I want to go back to one thing you mentioned earlier about climate change and how that factors in.
Yeah.
There's been so much emerging research on how warming temperatures are changing where a lot of these threats can survive. So I'm thinking of mosquito-borne diseases. The range for mosquitoes is shifting in Africa. There's been studies on that. Lyme disease is something we're now dealing with here in Ontario, more and more further north. We didn't see that before. That really poses a challenge, right, for people, individuals protecting themselves, and clinicians to know what to look for if someone comes in with symptoms. So let's unpack that a bit of how climate fits into what you're working on and how we navigate a changing climate that's also changing these health threats.
Yeah, when we think about climate change as and maybe many of us think about it as an ecological crisis, but it's really intertwined with pandemic risk. And the relationship, I wouldn't say, is kind of very linear. There's like it's a complex relationship. I think if we talked about deforestation, we're putting ourselves into contact with animal viruses, but then we're contributing to greenhouse gas emissions, which are changing temperatures. And then, just as you alluded, many of the most dangerous diseases in the world are spread through mosquitoes or other insects. And what's happening is, you know, when we talk about the world's maps will have to be redrawn because of climate change, the world's infectious disease maps are going to be redrawn because of climate change as well. And we're already seeing this here. You know, when I was doing my training, I went to University of Toronto for medicine, but I did my specialty training in the US, and things like Lyme disease and other tick-borne diseases were much more common there. We didn't really talk much about it here. Now, the entirety of the city of Toronto is considered an at-risk area for Lyme disease. Some of you may have just read this week about people who acquired malaria in the continental United States. These are not folks who traveled to, you know, some distant country, got malaria.
For the first time in 20 years.
For the first time in 20 years. So malaria in travelers coming back to Canada or the US, that happens not infrequently. Malaria that's acquired locally, once in a while, again, in the US, the last time was 2003. But now we actually have a slightly unique situation where we have cases in Florida and Texas at the same time. So it suggests to me that there's a shifting dynamic, and this means that we're all going to have to think about what do we need to do? How do we protect ourselves? But it also means healthcare providers are going to have to recognize diseases. I mean, I got 4 hours of tropical medicine training during my undergraduate medical education.
4 hours.
4 hours.
Yeah.
And then it was like, well, there you go. You've kind of.
But are these even tropical diseases anymore if they're starting to show up in areas that aren't considered tropical?
Well, I think the thing is, in that era, you know, there's an aphorism again in medicine, which is when you hear hoofbeats, think of horses, not zebras. You think of the things that are like local. Why would you think of something exotic? There's no reason to do so. That's not the world we live in today. I mean, people are coming from any remote part of the planet. So clinicians are going to have to get more familiar and up to speed. And going back to data and technology, here is how we can be delivering intelligence to empower governments for smarter policies, to help industry deploy and manufacture and distribute all the things we need, the vaccines, the personal protective equipment, therapeutics, and so forth, to empower and elevate the acumen of clinicians so that they can recognize what their patient might have, and then, of course, to be empowering the general public on having that greater literacy around, well, what do I need to do to protect myself? So I think there is, on one hand, I'm just going to compare and contrast. I realize this is a big threat we're talking about. It can, you know, it's easy to feel small in this grand scheme of pandemics. On the other hand, there is this incredible opportunity, and especially as we think about things like large language models and the intersection of what we've built with that type of technology, it is profound to think where we might be, not a decade into the future, it might even be like a year or two into the future. So
Cam, let's talk about that, because we're talking about AI and machine technology in the context of your work, but in the broader healthcare sector, how could AI help a family doctor in a small town who maybe has their sliver of knowledge? Is there a way to give them an encyclopedia, a global encyclopedia through AI or something that would allow them to really be able to diagnose a lot of these unexpected threats?
Yeah. I mean, I think there's a broader discussion about, clinicians couldn't possibly consume all of the scientific literature. I mean, even if we stayed awake 24 hours a day, we wouldn't be able to do that. So I think there's an opportunity there to be able to interact with data and to be able to make better clinical decisions. But something you've highlighted, which is it is impossible for a clinician to have situational awareness of what's happening around the world and to do this in real time. If any of you have been into a hospital recently, I just came from one this morning, seeing some patients, people are cognitively overloaded and very distracted. So you can imagine the clinician that is seeing you doesn't have the bandwidth to basically be like, tell me about everything happening in the world right now. But at the moment they need it, this is again where intelligence and technology can help us just at the moment when they need to know. I mean, the kind of platform we've built can literally find you wherever you might be and understand the context, that there's an outbreak over here, there's 11,000 people moving into your city, and one of them may be walking into your emergency department, and we should educate you about Marburg, what equipment you need to wear, how you need to isolate them, what tests you need to do. That's kind of where things are headed, where we can be way more anticipatory and less reactive, which is really where we are, where we've been today, up until now, and hopefully we're going to be able to shift that trajectory.
Certainly, I think that's what people want to know, right? If you're finding this threat, how do you stop it?
Right.
Before it becomes that massive global issue. What are all the steps you think are necessary to get there, to prevent the next pandemic?
Well, the way I see it, I think resilience comes in a distributed way. It's not, I think perhaps maybe in our minds, government is going to take care of the problem. And I understand public health falls into it is a core mandate, obviously, for government, but there are other public health actors that we need here. And so On one hand, certainly government needs to have this intelligence to make critical decisions. Industry needs to understand where its tools need to be deployed. Healthcare providers need to have that acumen, and then citizens need to do their part. So this is a whole of society problem. This is not a problem that government alone will solve, or academia alone will solve, or industry alone will solve. We need to democratize these insights so everyone understands how to do their part and do it in a coordinated fashion. I know that sounds very challenging and kind of lofty, but technology, this, where we are today, we have the capabilities of being able to distribute these kind of insights to mobilize a timely, coordinated response to threats.
Mm-hmm. Something another doctor shared with me recently has stuck with me, the notion of viruses don't respect borders, and what happens in one country can happen in another.
Yeah.
We're so hyper-connected nowadays, and I think that there's this growing sense that, the health issues here in Toronto, in Canada, in the US, what happens overseas really matters to us too. Do you think there's enough focus on that, even now?
Yeah, I'm glad you raised that question, because actually it's inspired BlueDot's name. Blue Dot is from Carl Sagan's Pale Blue Dot, and I was in high school when he talked about that, and he asked, for those of you who don't know, he asked NASA to turn the Voyager probe around and point back into the solar system just as it was leaving, and there was one pixel that was blue, which he called the blue dot, and he was like, that's all of us. Every person who's ever lived is here. Like it or not, this is our home. We're all in this together. So that inspired the name, but I think the point you've really highlighted is something we are actually doing, in fact, in collaboration with the federal government here, is helping elevate capacity in resource-limited countries. The best defense for a country like Canada, which is a microcosm of the world, we are one of the most mobile populations on Earth, is a good offense. And so we're working in places like Southeast Asia to help elevate their surveillance capabilities, their abilities to rapidly identify and detect and respond to outbreaks there before they spill across international borders. So that kind of prevention is really what we need to be doing. I think we're still in the mindset of that we are an island and we can kind of just close off our borders. The world is so intertwined that's just not a viable solution going forward.
Thank you, Kamran. That's absolutely
so
fascinating. Thank you to both of you. Thank you, Kamran. Thank you, Laura.
Thank you.
All right.
Great.
Thanks a lot.